Hey everybody, just to finish up the chapter on bones, we were talking about bone remodeling, types of cells that help do that, osteoblast, osteoclast, and we began to discuss the idea that you're going to lay down bone upon lines of stress. That's referred to as Wolff's Law or bone remodeling. You're putting your calcium effectively down where it's experiencing the most stress. Um, the book says that you have a new skeleton every 7 to 10 years. We kind of talked about that in class. But what happens if you have a fracture or something that needs healed? It's effectively the same thing as endochondral growth. You just lay down a squishy cartilage that calcifies, that repairs as bone. However, because cartilage is avascular, you're going to find much more healing in the bone section than in the cartilage. Cartilage has difficulty healing because of the lack of oxygen. If your fractures, if you can see the bone, that's considered open. Or if you have to go in and open the body to fix that fracture, that's an open reduction. If you can't see the bone, that's closed. Or if you can pop it back into place without doing any surgery, that's closed reduction of the fracture. So I want you to practice some of these fracture names. No open and closed. Do you see the bone? Do you not? Did it require opening the body? Did it not? Comminuted means you could think of it as, well, I have to think of it as movement of the bone. Um, when you're thinking of commute is the word that it makes me think of is the bone move. It's broken, fragmented bits of it move from the main area is how I reason it out. Green stick is, I'll show you a picture here in a second, but it's like a wet stick that's been bent, impacted, one's been driven into the other. There are special types called Potts and Collies, and then small stress fractures like you might get from something pressing on something else, or in the case of extreme shin splints or something. An avulsion has been torn off completely, where Osgood-Schlatter disease is where you will see, this isn't a very extreme example, I need to get a better picture. If you touch underneath your kneecap, if you had super active quads when you were younger, maybe you did football or track or dance or gymnastics, you may have a very large tibial tuberosity where your quadriceps muscles just pulled on that and it was pulled outward. And so now you have this big bump under your knee. Maybe it gives you a little pain, maybe not. It's just called Osgood-Schlatter disease, nothing to be that concerned about. Look at this picture. Something, I don't know, a rock, a hammer has smashed into that skull plate. That's a depressed fracture where it's been pressed into the body. Compression fractures can occur at vertebrae. Maybe it's the result of osteoporosis where they're pressed into one another. Non-displaced stay in the same location. Displaced are in a different location. Fractures can also be pathologic due to a bone cyst or something. Here you can see that tumor. I don't want that. Here's some pictures. Green stick where you imagine like a wet stick, like a fresh stick off a tree that you've bent. Kids do a lot of weird stuff. Kids fall, kids like that. They break bones all the time. But if a kid is coming in with green stick fractures all the time, especially in the same spot, like on the arm or the leg, it can sometimes be a sign for either malnutrition or neglect, maybe abuse. They're being picked up and thrown or slammed against something, and they just always have these green stick fractures twisted. Like if somebody grabbed onto them and they try to pull away, green stick fractures are kind of an early indicator. Looking at the time, sorry. Colles fractures have to do with the carpals. I use the C in Colles and the C in carpal to help me. Potts, imagine you're ice skating and you fall backwards and you catch yourself on your wrist. We tend to break the end of our radius or ulna right there. So that's referred to as a Colles fracture. Or Potts fracture is the distal end of the fibula and the tibia. I use the word, imagine like hitting your foot in a hole and twisting. Or playing soccer and you twist and you kick wrong. Now you've torn and broken that bone. I use the P in Potts and the P in pedal for foot or pedal, and podiatry. The P in Potts, that's what my mnemonic is. C for carpal, P for pedal. Impacted, look how that one's impacted into another. Spiral, it's twisted. And look at this. Comminuted, imagine like something horrible, like a car wreck. Those fragments, they're everywhere. Pathologic bone cyst, maybe a tumor has built up. You can see the difference in density between the tumor and the bone. You can see here the breaking of the bone that's happening because of that tumor. Just so much pressure built up, like eosinophilic granuloma. So how would a bone fracture repair? Well, effectively, just like you would skin, and just like you would grow that bone. We're going to bring blood to the area. We're going to bring oxygen. We're going to bring platelets. We're going to form a fibrocartilage callus that's going to be replaced by bone. Then you're going to remodel the bone. So just to see it after the initial break, those arteries, you're inflaming it, you're bringing all of your nutrients, you're bringing your supplies, you're scabbing effectively. You're filling that with cartilage, fibrocartilage, making a callus over that break. Those chondroblasts produce that fibrocartilage that's ossified. So you form a bony callus over that. Tissue binds those broken ends together, and then you eventually remodel the bone back to whatever shape it was in when those two healed together. That's why sometimes with a fracture, they have to put it back with a splint so that it doesn't heal at a weird angle. So again, just know the steps. Inflammation, hematoma, fibrocartilage callus, bony callus, healing. Same thing. Fracture, hematoma, fibrocartilage, bony callus, healing. And there's our picture there. You can read through here. There are some ideas of how to increase healing by using electromagnetic fields to increase that. Here's the idea about Wolff's Law, laying down bone over lines of stress. We know that weight building exercises and the idea of gravity and air pressure and all of that helps play a role in bone deposition and making sure that we're keeping our bones strong. And that can begin to have negative effects as we age. We don't make collagen as well. We don't. Estrogen plays a role. Osteoporosis plays a role in bone formation. So you may begin to see bone demineralization and decrease in protein synthesis as we age. Here's a picture of osteoporosis. Look at that. Kind of like a crushed body, the vertebrae there. That's not great. That's why you tend to get shorter and shorter as you age. Multiple myelomas, blood disorders, cancers that can get into the blood cells and attack the bone marrow, and then that's horrible, can form leukemia and other types of cancers. Enchondromas is Ollier disease. It's a rarer disease, but you may see it as tumor growths on an x-ray. They may not understand what it is. It's an issue with cartilage. These tumors can all potentially become cancerous. It may happen on one side of the body or both sides of the body. Eventually, these tumors can get so large that they eventually cause complete disuse of the features, the areas where the tumors are. Enchondromas or Ollier disease. For teeth, I don't need you to learn much. I've only got a couple minutes here before I have to end the video. For teeth, I just need you to be aware that they are there. They're a gomphosous joint. The outer dentin forms the majority of the tooth. Those cells are formed as well as the cells that create the enamel, the hard 95% calcium salts, much harder than bone. Those are formed in fetal development. They protect the tooth, but it can be worn down. The dentin, we're going to feel those pain receptors, feel hot, cold, acid. Once the enamel is gone, it's gone. And so those cells are gone. There's no way to reform the enamel once those cells are gone. So those odontoblasts form the dentin, and those still remain. So you can kind of repair your dentin. The ameloblasts that form the enamel, those are gone and cannot regenerate or regrow in our current. There are people doing studies to figure out how we can initiate those, but don't be fooled by drinks or toothpastes or anything that tells you can regrow your enamel. You cannot. Those cells do not exist in your stage until we get better at our technology and better at our medicine. Those ectodermal mesenchymal cells have differentiated during their embryonic development into odontoblasts or ameloblasts, and once that enamel is gone, it's gone. You can fill the holes temporarily, like with a filling, or perhaps Sensodyne. You can put special molecules in there, like hydroxyapatite toothpastes, to fill the holes, but it's not a permanent fix.